Hi, my name is Brandy Butcher, and I am doing component 3, which is Capstone project literature review for SIM 499 for American Sentinel University RN to BSN SIMPATH program. I've been a nurse for 10 years. In the last 5 years, I've been working in the emergency department. After 3 years of being in the emergency room, I could tell that I was not giving patients the compassion, the empathy, and the care that they deserved. I love the emergency room. I love all the craziness about it. I love never knowing what's coming in. But over time, all that weighs on you. I've seen babies pass away. I've seen children be attacked by dogs and pass away. Bad car accidents where people will never be able to walk again. And then every day in the location in which I work, we have multiple overdoses. And these overdoses, they overdose and we bring them back, and then they go right back out and do it again. Sometimes we see the same patients 2 and 3 times a day. And I know that seeing that and being frustrated, not being able to correct the problem, for all of it, just weighs on you over time. And it started to bother me. So I decided to leave the emergency room. So I went to interventional radiology, more of an outpatient setting. And I could tell a huge difference within the several months of being there. I definitely started to be more compassionate, show patients who I truly am, and be able to offer more of myself and more adequate patient care. So, with that being said, that's why I chose to do my capstone project of nurse burnout and compassion fatigue. I'm going to identify some articles in which I chose to help get my point across with this topic. So I used the database through school, ProQuest Central, to get some of my scholarly articles. When I used the terms nurse burnout and compassion fatigue, I got 2,109 total results. Of that, 2,100 of them were scholarly articles, 1 conference paper, and 8 trade journals. I also used Google Scholar, which gave me 27,400 results, and I used Medline, which gave me 120 results. So throughout reviewing these articles, the problem seems to, each of these articles are asking the same problem per se. They want to determine compassion satisfaction, compassion fatigue, burnout in emergency department nurses throughout the United States. They want to figure out the relationship between compassion fatigue and burnout. One of them was discussing why it's such a harsh term when you use the word burnout for emergency room nurses, but it's almost softer or more accepted if you use it in relation to speaking of a hospice nurse or an oncology nurse. Another article discussed Does compassion fatigue exist on a continuum of occupational stress? And if so, is burnout a precondition for compassion fatigue? And then the last article that I did was stress related to work and home life. So I think that is a big issue also, just that if you're stressed at home, you're going to bring it to work and vice versa. So I'll dive deeper into these articles throughout my project and just hope that we can shed some light on this subject, especially it's only getting worse, and I know it's been around for a long time, but over the last 2 years we've had COVID, which has made nurse burnout even more tremendous, just because of the pressure, not only from everywhere that nurses work, but also from the public. We've done this same job for many years, and nurses are burned out just from their everyday job, and then throwing COVID in on top of it, and you're working longer hours, your conditions that you're working in are way worse, so it only adds to the problem. And I would like to try to come up with some things to implement to help decrease the amount of nurses leaving the bedside. Thank you so much.